Good morning, all. I'm Srishna K, first MSc Biology student, St. Mary's College, Thrissur. Today we are going to deal with the topic autoimmune diseases. Autoimmunity. Early in the last century, Paul Ehrlich realized that the immune system could go awry and instead of reacting against foreign antigen, could focus its attack on self-antigens. He termed this condition horror autotoxicus. We now understand that while mechanisms of self-tolerance which normally protect an individual from potentially self-reactive lymphocytes, they may fail. This result in an inappropriate response of the immune system against self-components termed autoimmunity. Autoimmune diseases are classified into two, organ-specific autoimmune diseases and systemic autoimmune diseases. Organ-specific autoimmune disease. In an organ-specific autoimmune disease, the immune response is directed to a target antigen unique to a single organ or gland, so that the manifestations are largely limited to that organ. The cells of the target organ may be damaged directly by humoral or cell-mediated affected mechanism. Alternatively, the antibodies may overstimulate or block the normal function of target organ. Examples: Hashimoto's thyroiditis, autoimmune anemia, Goodpasture syndrome, insulin dependent diabetes mellitus, etc. Hashimoto's thyroiditis. This is most frequently seen in middle aged women. Here, an individual produces autoantibodies and sensitized Th1 cells specific for thyroid antigens. The delayed type hypersensitivity response is characterized by an intense infiltration of the thyroid gland by lymphocytes, macrophages, and plasma cells. These form lymphocytic follicles and germinal center. The ensuing inflammatory response causes visible enlargement of the thyroid gland or goiter. Antibodies are formed to a number of thyroid proteins, including thyroglobulin and thyroid peroxidase. Both of these are involved in the uptake of iodine. Binding of the autoantibodies to this protein interferes with the iodine uptake and leads to decreased production of thyroid hormones. Autoimmune anemias. Autoimmune anemias include pernicious anemia, autoimmune hemolytic anemia, and drug-induced hemolytic anemia. Pernicious anemia is caused by autoantibodies to intrinsic factor, a membrane-bound intestinal protein on gastric parietal cells. Intrinsic factor facilitates uptake of vitamin B12 from the small intestine. Binding of the autoantibody to intrinsic factor blocks the intrinsic factor mediated absorption of vitamin B12. In the absence of sufficient vitamin B12, the number of functional mature RBC decreases below the normal. Pernicious anemia is treated with injection of vitamin B12. An individual with autoimmune hemolytic anemia makes autoantibody to RBC antigen, triggering complement mediated lysis or antibody mediated opsonization and phagocytosis of RBC. One form of autoimmune anemia is drug induced. When certain drugs, such as penicillin, interact with RBC, the cells become antigenic. Goodpasture syndrome. In Goodpasture syndrome, autoantibodies specific for certain basement membrane antigens bind to the basement membranes of the kidney, glomeruli, and the alveoli of the lungs. Subsequent complement activation leads to direct cellular damage and an ensuing inflammatory response mediated by a buildup of complement split products. Damage to the glomerular and alveolar basement membranes lead to progressive kidney damage and pulmonary hemorrhage. Death may ensue with several months of the onset of symptoms. Biopsies from patients with Goodpasture syndrome stained with fluorescent labeled anti-IgG and Ig3b C3b reveal linear deposits of IgG and C3b along the basement membranes. Insulin dependent diabetes mellitus. It is caused by an autoimmune attack on the pancreas. The attack is directed against insulin producing beta cells that are located in the spherical clusters called islets of Langerhans scattered throughout the pancreas. The autoimmune attack destroys beta cells, resulting in decreased production of insulin and consequently increased levels of blood glucose. Several factors are important in the destruction of beta cells. First, activated CTLs migrate into an islet and begin to attack the insulin producing cells. The first CTL infiltration and activation of macrophages, frequently referred to as insulinase, is followed by cytokine release and the presence of autoantibodies, which leads to a cell mediated DTH response. The subsequent beta cell destruction is thought to be mediated by cytokines released during the DTH response and by lytic enzymes released from the activated macrophages. The abnormalities in glucose metabolism that are caused by the destruction of islet beta cells result in serious metabolic problems that include ketoacidosis and increased urine production. The late stages of disease are often characterized by atherosclerotic vascular lesions, which in turn cause gangrene of the extremities due to impeded vascular flow, renal failure, and blindness. If untreated, death can result. The most common therapy for diabetes is daily administration of insulin. This is quite helpful in managing the disease, but sporadic doses are not the same as metabolically regulated continuous and controlled release of the hormone. Periodically injected doses of insulin do not totally alleviate the problems caused by the disease. Another complicating feature of diabetes is that the disorder can go undetected for several years, allowing irreparable loss of pancreatic tissue to occur before treatment begins. Graves' disease. The production of thyroid hormone is carefully regulated by thyroid stimulating hormones TSH, which is produced by the pituitary gland. Binding of TSH to a receptor on thyroid cells activates adenylyl cyclase and stimulates the synthesis of two thyroid hormone, thyroxine and triiodothyronine. A patient with Graves' disease produces autoantibody that bind the receptor for TSH and mimic the normal action of TSH, activating adenylyl cyclase and resulting in production of the thyroid hormones. Unlike TSH, however, the autoantibodies are not regulator and consequently they overstimulate the thyroid. For this reason, these autoantibodies are called long-acting thyroid stimulating antibodies. The diagrammatic representation is shown here. In Graves' disease, binding of autoantibodies to the receptor for thyroid stimulating hormone induces unregulated activation of the thyroid, leading to overproduction of the thyroid hormones. Myasthenia gravis. Myasthenia gravis is the prototype autoimmune disease mediated by blocking antibodies. A patient with this disease produces autoantibodies that bind the acetylcholine receptors on the motor end plates of muscles, blocking the normal binding of acetylcholine and also inducing complement mediated lysis of the cell. The result, sorry, the result is a progressive weakening of the skeletal muscles. Ultimately, the antibody destroys the cells bearing the receptors. The early signs of this disease include drooping eyelids and inability to retract the corners of the mouth, which gives the appearance of snarling. Without treatment, progressive weakening of the muscles can lead to severe impairment of eating as well as problems with movement. However, with appropriate treatment, this disease can be managed quite well and affected individuals can lead a normal life. In this binding of autoantibodies to the acetylcholine receptors, the right side blocks the normal binding of acetylcholine and subsequent muscle activation. In addition, the anti-acetylcholine receptor and autoantibody activates complement which damage the muscle end plates. The number of acetylcholine receptors decline as the disease progresses. Systemic autoimmune diseases. In systemic autoimmune diseases, the response is directed towards a broad range of target antigens and involves a number of organs and tissues. This disease reflects a general defect in immune regulation that result in hyperactive T cell and B cell. Tissue damage is widespread both from cell mediated immune responses and from direct cellular damage caused by autoantibodies or by accumulation of immune complexes. Examples: systemic lupus erythematosus, multiple sclerosis, rheumatoid arthritis, etc. Systemic lupus erythematosus. One of the best examples of a systemic autoimmune disease is systemic lupus erythematosus, simply SLE. It is typically appears in women between 20 and 40 years of age. SLE is characterized by fever, weakness, arthritis, skin rashes, and kidney dysfunction. Affected individuals may produce autoantibodies to a vast array of tissues and tissue antigens such as DNA, histones, RBCs, platelets, leukocytes, and clotting factors. Interaction of these autoantibodies with their specific antigen produces various symptoms. For example, autoantibodies specific for RBC and platelets can lead to complement mediated lysis, resulting in hemolytic anemia and thrombocytopenia, respectively. Excessive complement activation in patients with severe SLE produces elevated serum levels of the complement split products C3A and C5A, which may be 3 to 4 times higher than normal. Next disease, multiple sclerosis. It is the most common cause of neurologic disability associated with disease in Western countries. The symptoms may be mild, such as numbness in the limbs, loss of vision, etc. Most people with multiple sclerosis are diagnosed between the ages of 20 and 40. Individuals with this disease produces autoreactive T cells that participate in the formation of inflammatory lesions along the myelin sheath of nerve fibers. The cerebrospinal fluid of patients with active MS contains activated T lymphocytes which infiltrate the brain tissue and cause characteristic inflammatory lesions, destroying the myelin. A breakdown in the myelin sheath leads to numerous neurologic dysfunction. Epidemiological studies indicate that MS is common in the northern hemisphere and interestingly in United States. MS affects women 2 to 3 times more frequently than men. The cause of MS, like most autoimmune disease, is not well understood. However, there are some suggestions that infection by certain virus may predispose a person to MS. Rheumatoid arthritis. It is common autoimmune disorder. Mostly affects women from 40 to 60 years old. The major symptoms is chronic inflammation of the joints, although the hematologic, cardiovascular, and respiratory systems are also frequently affected. Many individuals with rheumatoid arthritis produce a group of autoantibodies called rheumatoid factors. These are reactive with determinants in the Fc region of IgG. The classic rheumatoid factors is an IgM antibody. Such autoantibodies bind to normal circulating IgG, forming IgM-IgG complex. These are deposited in the joints. These immune complexes can activate the complement cascade, resulting in a type 3 hypersensitivity reaction, which leads to chronic inflammation of the joints. Thank you.